back to Max Gatko and you're watching the Lux Dentistry channel. In today's episode, we are going to discuss what is a root canal, why may I need one, and how do root canals work. And if you watch this video until the end, you will learn the biggest secret in a long-term success of a root canal that dentists don't want you to know. So let's go. First, let's answer, what is a root canal? Root canal treatment is a procedure that whenever I tell to the patient they need root canal, they always have to go to the bathroom. All jokes aside, root canal treatment is a dental procedure that involves removal of the pulp of the tooth, this red thing over here, cleaning and disinfecting that space, and enlarging that space slightly in order to be able to fit a specialized dental filling material. So what do you need to know about the pulp? Pulp is a part of the tooth that supply nutrients to the tooth via blood vessels and neural innervation via sensory nerves that causes all the pain sensation that people often experience with a deep cavity or broken teeth. So when do I need a root canal? Simple and short answer to that would be in 90% of the cases you would need a root canal when you have a inflammation or infection deep inside the tooth. Let me explain it in more details. But before I do that, let's not forget to smash that like button and to subscribe to the channel if you haven't done so already. When someone needs a filling because of the cavity in their tooth, and let's assume the person does not have time to do it or just ignores the recommendation of the dentist. So some time passes, usually months to several years, and the cavity tends to increase in size. So cavity increases in size. So the cavity or the bacteria in the cavity, technically, grows towards the pulp space because that's the way of least resistance. Given enough time, cavity progresses deep inside the tooth and eventually comes really close to the pulp space to cause increase in inflammation, this is inflammation, or goes right into the pulp space and causes bacterial infection. Sometimes combination of both is also possible. So you get infection. Let's just draw infection. This is not the only reason why one may need a root canal. Often root canals are necessary after trauma to the tooth, or even in some rehabilitation cases where one needs to use root canal space in order to save the tooth. We will not talk about this today as it will deviate us from the topic and make this video way too long. So how is a root canal done? And will it hurt me? Good news, the answer to that question is in 95% of the cases you will not experience any pain during the root canal procedure. For 5% of the people who do experience pain, it's usually because they have waited way too long to come to see a dentist and they have intensive infection around the tooth that getting numb is just very unpredictable in itself. Before root canal starts, you will be obviously numbed using local anesthetics. Once you numb, an isolation device such as dental dam will be introduced inside your mouth that will create an isolation and prevent any cross-contamination between your mouth and the working field. See, saliva in your mouth has a lot of bacteria and you want to keep it out of the working space. Once the dam is on, an access hole will be made using a drill in order to reach a pulp chamber. Once the pulp is reached, the pulp itself will be removed and the canal which housed the pulp will be cleaned and disinfected. Once cleaning and disinfection is done, we would place a biocompatible filling material called gutta percha along with the sealer, which is also biocompatible. Quality of the fill will be checked using dental x-ray, and you will get temporary filling or restorations on the top of the tooth to go home with. Once home, you will likely to experience dull ache for several days, maybe up to a week, depending on how long the procedure was, how difficult the root canal was, and how you came in prior to the dentist. That was a lot of info. So what is the secret, the big secret that affects long-term success of a root canal that no dentist wants you to know? So the secret lies in effective disinfection and isolation. Remember, the most important indicator of successful root canal in the long run is how effectively each canal was cleaned using disinfecting agents and if dentist has used a rubber dam. Now guess why it's a secret? Most of the dentists do not know or unable to use a rubber dam in a timely and efficient manner. So what happens when dentist does not use a rubber dam? You get saliva and other junk from the mouth flowing right into the canals, and any attempts to disinfect this space goes down the toilet. That's why dental dam or rubber dam is so important and considered to be a gold standard in any root canal procedures. Just so you know, rubber dam can be efficiently used in about 95% of the cases. So if your dentist does not use the rubber dam, you should at least ask why they're not doing so. Yes, in about 5% of the cases, dental dam use is close to impossible because inability to grasp on anything, but you should always ask. So if your dentist cannot provide a legitimate reason for not using a dental dam, never attempts to use a dam. I do not think that dentists should be doing your root canal procedure in the first place. Without dental dam, your long-term success of a root canal becomes unpredictable and left completely to chance alone. Thank you for watching this episode until the end. Again, don't forget to smash the like button and to subscribe to our channel if you want to continue to learn about dentistry. I wish you lots of luck and lots of health, and see you next time.